CLS supports HB 1077 because it introduces needed reforms to strengthen consumer protection. It keeps residential utility customers connected to and paying for utility services, ensures households with chronic medical conditions, seniors, young children, and survivors of domestic violence remain connected to life-essential services, and ensures consistency and equity across the Commonwealth in how utility customers are treated, regardless of the county they live in. Ms. C reached out to CLS in September 2023. She is 95 years old and currently bedridden while recovering from infected bed sores. She has a hospital bed, which relies on electricity to operate. Despite the necessity of electricity for Ms. C's health, her service had been terminated in September. The utility refused to accept additional medical certificates and refused to accept anything less than 50% of her balance to restore, an amount that was out of her reach on her Social Security income. Ms. C was forced to live with a neighbor for several weeks while her service remained off. Ms. C's electricity was only restored thanks to the advocacy of CLS staff and the use of a LIHEAP grant, a resource that was unavailable when Ms. C was first shut off and is only available during specific months. Several provisions in HB 1077 could have ensured that Ms. C remained connected to medically necessary service, including longer medical certificate duration, expanded notice of termination, and referral to customer assistance programs. CLS works with many clients like Ms. C who are eligible for utility customer assistance programs and often fall behind because they are not referred to those programs early enough to prevent accrual of arrears. We also serve many clients who are just above eligibility for these customer assistance programs, whether they're seniors on fixed incomes or working families making too much to qualify for assistance but still struggling to make ends meet. Many of HB 1077's amendments to Chapter 14 would ensure that these customers, too, are able to stay connected to service. In October 2022, Ms. A came to CLS. Her gas service shut off thanks to a large bill driven by high usage. Her Social Security disability income, combined with her nephew's employment income, puts their household over income for customer assistance programs in LIHEAP. At the same time, it does not provide them with enough income to repair Ms. A's childhood home, which is in a state of disrepair. Ms. A has serious health issues. She needs to go to dialysis 3 days a week. When she came to CLS, she had already used medical certificates, so despite these serious health conditions, she was unable to access additional certificates to prevent shutoff or restore service. With our assistance, Ms. A sought a payment arrangement from the Public Utility Commission, which got the services restored in November 2022. At that time, based on the current Chapter 14 payment arrangement rules, the payment arrangement, combined with the monthly charges, came out to almost $1,000 a month, nearly a quarter of the household income and far from affordable. Despite making partial payments as much as possible, this past summer, Ms. A received additional shutoff notices for her gas service. Because she had already received a PUC payment arrangement, another arrangement was not possible. Luckily, we had helped Ms. A apply for one-time utility assistance through the Homeowners Assistance Fund, funded by ARPA funds, when she first came in October 2022. And after 11 months, they finally paid her past due gas bill, preventing shutoff and ensuring she'd have heat this winter. Ms. A is also working to address the underlying repair issues that are driving up her gas bills, but applying for and getting that assistance has also taken time. The updated provisions in HB 1077 that provide the PUC with additional flexibility in granting payment arrangements likely would have enabled Ms. A to get a more affordable payment arrangement from the beginning and would have been critical to keep Ms. A connected if grant funding hadn't been available. My written testimony contains more information on how I believe additional provisions of HB 1077 will help utility customers stay connected to service, including addressing language access issues and termination notices, and ensuring PGW is treated the same as other utilities across the Commonwealth. The proposed amendments in HB 1077 directly address many of our clients' struggles to stay connected and remain paying customers the utilities, and would positively impact the lives of all of our clients. On behalf of all of the low and moderate income residential utility customers CLS works with on a daily basis, I urge this committee to support HB 1077. Thank you for your consideration.